Hey, it's Dr. O. Semaglutide has become increasingly popular for diabetes and obesity treatment over the past couple of years, so I'd like to give my perspective on it as a physician who has prescribed a lot of it. First, semaglutide has a few different forms. There's Ozempic, and that's for diabetes. There's Wegovy, which is for weight loss. Those are both injectables. And then there's Rybelsus, and that's an oral medicine for diabetes. So the way that these work, they're in a class called GLP-1 agonists. And what those do is they increase insulin secretion. They decrease glucagon secretion, and then delay gastric emptying. And what these do is they result in decreased blood sugar and decreased appetite. So the appetite suppression is potent, so the doses for all the forms of semaglutide must be increased each month to the desired level or the user will become nauseated, which we obviously don't want. Usually the nausea that results despite dosing appropriately resolves or at least lessens after a few days. And during this time, anti-nausea medicine may be used. So the main anti-nausea meds for that would be Zofran. That's a dissolvable that you just put on your tongue and it dissolves on its own, so you don't need to worry about taking any liquids with it. That could, though, worsen the constipation or diarrhea that semaglutide could cause. So you have to be mindful about that. Another option is Phenergan. That needs to be taken with liquid or whatever. I mean, you could take it with pudding or Jell-O or something, but generally with liquid. That's usually more potent than Zofran, but it causes sedation, so be mindful of that. Overall, semaglutide is well tolerated. I somewhat commonly see changes in bowel habits, but other side effects are few and far between. There is a black box warning as contraindicated for patients with a personal or family history of medullary thyroid carcinoma or with multiple endocrine neoplasia syndrome type 2. So I simply will not offer semaglutide to those patients who have that history. In terms of cost and accessibility, that's probably the trickiest part. Some insurance companies cover semaglutide extremely well, and some don't cover it at all. Some forms, as the date of this video, are available, like Ozempic and Rybelsus. Wegovy has recently not been available, but that's supposed to change pretty soon per the pharmaceutical rep that comes to our office. Due to these availability issues, some patients have opted to pursue semaglutide treatment at a compounding pharmacy. The semaglutide in this case is not FDA approved. Instead, it's manufactured in another country and shipped to a U.S. pharmacy. The compounding pharmacy then mixes it with B12. That way it's like a slightly different substance that's legal to dispense. Then the pharmacy can just charge a flat amount with a valid prescription. A local compounding pharmacy here charges about $200 per month for their formula. And that's sometimes more affordable than a situation where insurances refuse to cover it. So it still can be an option for patients who are just completely shut down by their insurance companies and the retail pharmacy is saying it costs something like $1,000 or something, which obviously we don't want patients to pay. In terms of results, it's a powerful tool for controlling blood sugars and weight. I've seen A1C, like the hemoglobin A1C levels, drop by 5+ points after just a few months on it. In terms of weight, I've seen 80 pounds of weight loss in multiple patients or more in a year of use. That's over a year. But still, that's significant. And those effects generally continue as long as the medication is continued. But they will reverse over time if the medication stopped or if no other changes in lifestyle have been made. So, whether it's taken for diabetes or weight loss, improving diet and exercise is extremely important for sustained A1C and weight control, and then hopefully eventual completion of treatment. We don't want patients necessarily to take medications, but if it's controlling a medical problem, we're okay with that, but ideally we want to get patients off all medications. But that's my rundown on semaglutide. If content like this is worthwhile, consider liking and subscribing. That will help me to gauge whether to make more of these. And please let me know in the comments if there are any future topics you'd like to cover. Until next time, eat your fruits and veggies, exercise, sleep, and I'll see you later.